Hello there everyone, and welcome to another video with Hypnotherapy Training International. And today Dr. John Butler will answer us a few questions about the content of his hypnotherapy, of his medical hypnotherapy course. And so Dr. Butler, if you can tell us a little bit what to expect that we can learn in such a course. It's a very high level advanced course. So maybe you can take us a bit through the details of what you teach in that beautiful class.
Okay, thank you. And thanks everybody looking in. The hypnotherapy for medical applications is a very, very important course. All of our courses, I believe, are important, but this one has such a wide range of applications and different groups of people who can use it. We see a lot of stress in medicine, and a lot of doctors often feel dissatisfied because they have to process patients so quickly and often know that these people have stress and emotional factors and often don't know much about how to help them, but refer them on. And that may take quite a while for them to get the psychological help they need. With medical hypnotherapy training, that as we teach it, they learn tools, techniques, methods that will enable them to make a positive impact on the patient's well-being and their interactions with medicine. Now, that is not only about helping them physiologically, because as we know, placebo is a very important part of medicine. The mind-body interaction is very real and being very much more studied now in the last 20 to 25 years than in the past. But every good doctor knows that a lot of the help they give the person is also psychological, having a reassuring and boosting and uplifting effect, helping optimism. And because we know that stress and negative states of mind tend to undermine the person's systems, cardiovascular, undermine their immune system. And a lot of people, of course, have problems then over time with the physical effects of their psychological state. On top of that, of course, they get into negative behaviors, using recreational drugs, eating badly. And so that's never very good because, of course, you're wasting a lot of the time of the doctor. You're getting medicine, then you're doing things which are not so healthy, ending up back looking for more medicine, a bit of a revolving door syndrome, as we call it. So emotionally impacting the patient is a part of medicine, the doctor-patient relationship. So many people, of course, who come on the course are not doctors, but they may have an interest in helping themselves physiologically with medical issues. They're having medical treatment, but they feel and believe they need help emotionally that will help their body systems as well, because we are self-healing, self-regulating organisms, and we can tap into that subconscious influence on the body. That's a core part of the teaching, and everybody can benefit from that. Many hypnotherapists come on our course because we're quite well known for the work we do in medical hypnotherapy. It's proven work. We've done it in many medical settings. And so we don't just talk a talk. We have walked the walk, and we are using methods that are among the very best we feel in the field. I've studied with very many medical hypnotherapists going back over a very long period of time, and incorporate some of the best methods that they use and other methods from my own experience. And every therapist learns to work in their own way. Now, with the medical hypnotherapy training, having that knowledge of how subconscious processes begin to interact through the physiology of the body, we teach you some of the basic neurology and physiology that'll help you become the best at giving good suggestions for people. Now, as we boost the natural healing mechanisms, that makes us able then to work better with medicine. If the person has to have chemotherapy, if they are having surgery, if they're having medical procedures that are difficult, they know how to relax. They know how to use their minds to help the medical procedure, to minimize negative side effects of medications, of the stress of surgery. They can do so much to help their own coping here and healing and getting out of the stress mechanism, because stress is a big part of medicine, often not acknowledged. Many illnesses in the past, they were called spasm illness. It's another word for stress illness, really. And over time, they become psychosomatic illnesses, maybe develop over time. It may even be that over time they develop an organic pathology, or at least it's exacerbating an existing organic condition. So basically, it's very important to know about stress mechanisms at the level of medical intervention and at the level of medical hypnotherapy. When you've got that, you've got so much you can do to benefit the patient. Working, not contradicting medicine, or you're not claiming to offer a medical treatment, but you're actually helping the body's own natural mechanisms and helping keep the person out of negative stress reaction, let's call it that, which is a big problem for people who are under pressure. We also use hypnosis for chronic pain, which is difficult to control by medicine often. We've used pain control in surgery, difficult medical procedures of various kinds, and with dental procedures. We've helped hundreds and hundreds of people cope with very difficult, painful procedures, including some who, because of problems with anesthetics, they have managed to have those procedures with no anesthetic, no chemical anesthetic, using their own mental anesthesia, which uses our own internal opiates and other pain chemicals, pain reduction chemicals that we have. So that's a very fascinating part of it as well. A person may combine the two. That's often a good idea. So they need less medication and have better results from that medication. And so much better healing and recovery. We are also looking at the psychosociological aspects of illness as well. Many people, if they have to have an amputation, maybe a mastectomy or whatever procedure that leaves them with visible physical effects that they don't like. Now, that can be very stigmatizing. It may interfere with their lives in different ways. And that's a great, great application of hypnotherapy as well in medicine, to minimize the negative impact of medicine on the person's psychology and their relationships generally. We, in hypnotherapy, as we teach it, teach an advanced form of analytical hypnotherapy, which means you can go to the deeper roots of the emotional issues, which over time have probably contributed or exacerbated certain organic conditions, because that's a known link now, that people who have had the most traumatic childhood experiences have higher rates of certain organic conditions later on in life. This is correlational. We don't know all the exact mechanisms. Medicine is a long way from fully understanding all of those links between the mind and body, all the ways thoughts and feelings activate the complex physiological processes of the body, right down to epigenetic levels. So we can intervene and help people even if we don't know all the links, because we know and can see such great results from that when it's used effectively. So there are so many applications of hypnotherapy in medicine for such a wide range of problems, and wide range of applications for helping people, not just on the physical level with medicine, but the emotional and stress level and so on. So I hope you would take that subject, get involved in it, study it greatly. And for any hypnotherapist, this becomes a major part of their practice, because when they get good results with clients, other clients recommend them, and they may well work in conjunction with a doctor's practice who sends them certain patients who need emotional and psychological help of the deep kind that hypnotherapy offers them to help them with the physical conditions. So I hope you will join us on one of our medical hypnotherapy courses. We have several of them run during the year. There's one coming up very shortly, and we look forward to seeing you on one of those courses very soon. Thank you very much for listening and watching.